PCSK9 is a key protein in the regulation of lipoprotein metabolism and acts by avoiding the recycling of LDL receptor to the surface of the cell. By this pathway, the number of LDL receptors in the surface is decreased. So the presence of PCSK9 in circulation will produce a lower number of receptors in the surface. By blocking PCSK9, in our case with monoclonal antibodies, so what we are producing is an increase in the recycling of LDL receptors. So at the end, we have more receptors in the surface. So we are enhancing the physiological way of creating LDL from plasma. In fact, we have a lot of information nowadays about the use of PCSK9 inhibitors in diabetic patients. The first thing we know is that PCSK9 inhibitors are highly efficient also in diabetic patients at the same range of in non-diabetic patients, producing an LDL decrease of about 60%, which is a lot. More than that, we know that PCSK9 inhibitors in a complex metabolic situation like diabetes produce not only a reduction in LDL cholesterol, but is also able of reducing other atherogenic particles like those derived from triglyceride-rich lipoproteins, remnants on IDL, by reducing the number of particles, reducing ApoB, or reducing also the non-HDL cholesterol, which is important in terms of reducing atherogenesis. Second aspect is about safety. We know that PCSK9 inhibitors in diabetic patients are very safe, and particularly because they do not increase the new onset diabetes associated to the use of other lipid-lowering therapies. And finally, and very important, we have data from sub-analysis from the Fourier and Odyssey outcome studies showing that PCSK9 inhibitors in diabetic patients increase the benefit of outcome reduction observed in non-diabetic patients. So the benefit observed in diabetic patients is about twice that observed in non-diabetic patients in terms of cardiovascular complications. What are the limitations of PCSK9 inhibitors? In fact, the only limitations probably are associated to the efficiency of drugs, so the balance between cost and effectiveness, because the only limitation is probably the cost of this medication. Is very safe, is very effective, but of course we have to use it in those patients who are going to take the maximum benefit of this drug. And because this is one of the problems, the health authorities and payers have put a lot of barriers to prescribe this drug. And this is one of the main limitations. For example, the amount of paperwork associated to the prescription of PCSK9 inhibitors is one important barrier to prescribe them. I think that apart from these bureaucratic things, there are no main aspects that could limit the use of this drug. The PCSK9 inhibitor must be prescribed to those individuals who have two conditions together. One, very high LDL cholesterol, and the second, high cardiovascular risk. So in diabetic patients, it's exactly the same. Those diabetic patients who have, despite the usual or the current lipid-lowering therapies, still remain with high LDL cholesterol and they have high cardiovascular risk will benefit from this therapy. However, we should mention that diabetes per se is already a high risk or very high risk condition. So in fact, all diabetic patients, particularly if they have already some kind of vascular manifestation, will benefit from this therapy if they still maintain an LDL above 70 despite the usual lipid-lowering therapy. The prescription of PCSK9 inhibitors should be addressed to those individuals with the highest LDL cholesterol and the highest risk for sure. Diabetic patients per se, they have already a high cardiovascular risk if diabetes is combined with an MI or other vascular alterations like stroke or peripheral artery disease. That makes an ideal condition to prescribe these drugs because according to the new European guidelines, these patients should achieve an LDL target of less than 55 milligrams per deciliter. So this is almost impossible to obtain with oral combination lipid-lowering drugs. So in these cases, for sure, PCSK9 inhibitors will be indicated. We know from sub-studies from the Fourier and Odyssey that diabetic patients who have had an MI, but a recent MI, a recurrent MI, or they have vascular affection in several coronary vessels, they will also benefit a lot. Also, those individuals with peripheral artery disease will also improve using PCSK9 inhibitors. Those who have been submitted to a CABG surgery, so also will have an increased benefit. So all these vascular conditions will underline those individuals who will benefit the most from these therapies.